Good morning. And we want to welcome everybody this morning. My name is Jan Marable, and I am the Education and Event Coordinator for Mental Health Awareness of Michiana. We're glad that you joined us today for our session on group therapy. Dr. Katie Steele is our speaker. And before I introduce her, I just want to say we want everyone to make sure you've taken the pre-test. So if you have not done that, please do that now. For people that are with us here in the room, the bathrooms, logistically, the bathrooms are down the hall to your left. And please, at any time, if you need to get up and move around, there's water in the back as well. To our virtual friends, we welcome you. Our speaker today is Dr. Katie Steele. She has always identified herself as a relationship therapist. She helps clients recognize and heal the dysfunctional interpersonal patterns that developed early in life and now interfere in their present happiness. Katie knew she wanted to be a group therapist from her early days in graduate school at Notre Dame. She led 4 groups a week in her solo practice for 20 years and still leads 2 co-ed groups a week. Katie has been deeply involved in group training for herself and others since joining AGPA in 1997 and is passionate about spreading the word about the power and promise of group therapy. She is a fellow of and has been involved in governance in AGPA, which is American Group Psychotherapy Association, where she is the former co-chair of the conference committee. We are excited to have with us sharing today, Dr. Katie Steele. I guess I'll use the mic.
Can you guys hear me okay, or should I use the mic?
Mike's helpful.
Use the mic. Excellent, that's fine. Okay, welcome. It's good to see everybody. I'm gonna start out like as a group therapist, I want involvement. So this isn't gonna be just a talking head. So if you could tell me, both webinar folks and local here, a little bit of why you're here. Give me your name and what your practice is like and what you hope to get from today. So, yeah.
I'm Mia Perillo. I am the Director of Programs at Youth Service Bureau of St. Joseph County in South Bend, Indiana. I am working on getting my licensure for my LCSW, but particularly with this session, I'm hoping to gather a up-to-date way and accurate way to explain group processes with our clients,
Right.
Because they are very anti-group.
Right.
So our local mental health agency kind of funnels to group first before they do individual. And that was a shift for us about 1.5 years ago. So just trying to best explain and provide information for that.
That's excellent. You're in the right place. Okay.
I'm Laura Russell. I'm at Maple City Healthcare Center. It's a federally qualified health center with behavioral health integration. So I'm one of the therapists there. We do several groups, but I am not doing groups, and so I'm just looking for more information.
Okay, great. Yes.
I'm Lisa Kelly. I'm executive director of NPAM, but also clinical clinician. And I would say that I've always been intimidated by the idea of doing and leading group therapy as opposed to something that might look more like a support group. And so I'm just really intrigued.
Great. Wonderful.
I'm Jennifer Grubbs. I have a private practice in South Bend, and I have a lot of ideas for starting groups. So I came here today just to hear how you offer them and the benefits of that, so I can better market that and then advertise for.
That's what's good.
Through the Grow Consulting and Counseling Services in South Bend.
Who's next?
I'm Joni Bradbury. I'm an LMHCA at Retta. It's a pregnancy clinic here in Elkhart. And we are adding mental health services now. So I primarily work with individuals, but we're adding groups.
Oh,
So
great.
I want to be prepared to add groups.
And those would probably be mostly support groups or
Therapeutic groups.
therapeutic groups. Okay.
Education.
Okay. Psychoeducation. Okay.
My name is Sean Rowe. I'm retired for many years. Okay. I have maintained my licensure as far as the licensed clinical addiction counselor. Since I've retired, I've been active over in South Bend. I've been For the St. Joseph County Veterans Court. I've been leading up primary mentoring
Mhm.
for vets that are struggling. I just recently received an accreditation as far as through it's called AGPA, Self-Healing Community Michiana.
Okay,
And what they do is provide training to go out, present in the community as far as ACEs, okay, child experiences. So the reason I'm here today is I want to get more updated. For many years, I did run group
addiction groups,
addiction primarily,
Mhm.
yes. So I'm here to learn.
great. Beautiful. How about online? We got everybody in the room, right?
Yeah.
Okay,
So online, we have Maria. She says, I have had limited group facilitation experience with very little training. I've often wondered if I could start some groups in my current private practice. We have Cindy from Ketamine is Hope, and she's just here to learn. We have Elise, who is an LMHCA in private practice at Psych Point, and she has very limited experience with group. She would like to build more skills and continue to grow in her confidence to facilitate groups in the future. We have Nancy, who is here to learn more about group therapy, especially ideas for getting it started. They think it may be harder these days as social isolation continues to increase and people seem to be losing or never gaining the ability to relate with other people. And then we have Amanda, who is running groups at a school in South Bend, and she is a school social worker.
okay, great.
So it seems like we have a lot of people who are here to learn about group therapy, similar to the people in the
Okay.
room.
So I'm gonna ask the newcomer just real quickly, could you just say your name and what you hope to get out of today?
Yeah, I'm Jessica Vigila. I'm an intern at M.
Oh, good.
And I hope to learn good techniques to use when working with clients.
Okay. So are you do you screen clients?
No, I work with them one-on-one.
Okay, all right. So, yeah, at some point, I want to talk a little bit about groups with MHAM. Because it seems like this is a possibility for people who go through, and I've thought about it, people who go through 12 sessions are rarely done. They've just scratched the surface in terms of becoming more psychologically minded, being able to recognize the things that are getting in their way, and they would benefit greatly from ongoing therapy in this kind of setting. So we'll kind of get to that at some point. All right. So I want to go over the learning objectives. I always, at the very end, you're going to be asked to evaluate based on learning objectives. So let's have them out there. The first one is identify the unique benefits of group therapy for clients and the ways group therapy can enhance a solo private practice. It's not moving. There we go. Identify strategies for screening potential group clients and overcoming resistances to joining groups. And that's something that I think is probably going to be really important for a lot of people, whether you're just starting or whether you're in an agency. I know that there was I heard a comment that people have perceived that Oaklawn doing all these groups, it's all second-class treatment. And I want to dispel that myth. Identify some of the ways cultural issues arise in group therapy and how to address them and how to learn more. Because this is gonna be like just skimming across the surface of so many different things, but I want to be able to provide guidance and direction for the next steps. And this is it, list opportunities for training to be a group therapist. And there are some wonderful ones. So let me talk just a minute about how and why I became a group therapist. I actually came to graduate school in my middle 30s to Notre Dame to train and really didn't expect to be a clinician at all. I thought I was going to be an academic. I was all involved in statistics and, research and all of that stuff. And I fell into a practice situation with the Omni Center for Women's Health and Medicine, which most people won't remember because it was in the late 80s. And they were a whole early, way ahead of their time. They were a holistic practice. And that was when I started my first groups as a practicum student. Nobody had been doing groups. I had done my first group experience at the counseling center at Notre Dame during my second year practicum. I somehow knew I was going to be a group therapist before I ever started a practicum. And I wasn't sure why that was exactly until years later when I remembered how powerful it had been for me to go to a church youth retreat. It was the first time, I don't know, I was probably like a sophomore in high school, that I really felt seen and heard and accepted. And it was a spiritual experience as well as, even though it wasn't focused on God or any of that, it was really just sort of being heard, feeling heard and seen for the first time. So that was really important. What happened with the experience in graduate school, when I was starting my groups, there was someone, well, let me just back up. How many people are familiar with Brene Brown? Okay, so how many people are familiar with John Bradshaw? Not many. So it's interesting because John Bradshaw, I'm going to go ahead and then I'll get that. John Bradshaw started the shame issue back in the 80s. His was Healing the Shame That Binds You. And Brene Brown said, I'm pretty sure that I wouldn't be doing this work without Bradshaw's book, Healing the Shame That Binds You. So that book was very influential at that time. And I dovetailed with that, wrote an article that I put out through a mailing thing, talking about the things that Bradshaw talked about, which was finding a family of choice, because it's important to do healing work, especially around shame, in a group setting. There is not a better place to heal shame than in a group setting. And I suspect every client will resonate with the idea that you want to heal the shame. They will say, I could never talk about that in front of a bunch of strangers. And that's where you say, that's how you heal it, because they don't stay strangers, So anyway, for those who might be considering wanting to build your practice now, I would suggest going on like coattails of Brene Brown, put something out there. She has this owning our story can be hard, but not nearly as difficult as spending our lives running from it. Embracing our vulnerabilities is risky, but not nearly as dangerous as giving up on love and belonging and joy. The experiences that make us the most vulnerable. Only when we are brave enough to explore the darkness will we discover the infinite power of our light. And this is why I'm a relationship therapist, because in my experience, 80 to 90% of people's happiness or unhappiness is related to relationships. And in terms of dysfunctional patterns, if you think about it, most of those were set in place in a relationship setting, whether it was the family of origin, or it was a school setting, or it was friends or siblings, or it was just and how many people here are EMDR therapists? Okay, so one of the things that you look at is, what are we targeting? What's the trauma that is interfering in your life? And almost all of them are relational. I would be very surprised. That's my other specialty. So I was trained as a group therapist in the late 80s, and then I trained as a EMDR therapist in 1996. And those have been my two specialization certifications. And they dovetail really well. I tell my clients a lot of times that when we grow up in dysfunction, it's like the road of life is filled with tiny little ruts that we go, some big ones, but when we grow up in dysfunction, we grow these tiny little misshapen wheels, instead of big round wheels. And so EMDR can round out your wheels, but group therapy grows them large. And you need large wheels to go smoothly over the little bumps. When you hit the big bumps, you recognize those, but you don't want to be jarred at every little thing that comes up. So group therapy has incredible potential for healing relational issues for clients, as well as providing a secure base for therapists. So what happened for me was I started my first group in 1989. And that group, I made all my mistakes in to start with and ended it after a year. That was before I got into the kinds of training that I have been in with the American Group Psychotherapy Association. They've been really, really powerful. So I started the next one at the same time the first one ended. And then I started another one the year after that. And then I ended up in private practice because the organization that I was contracting with decided not to do that anymore. And then another group in 1991, and then another group in 1993. So that I had 4 groups going, 5:30, 7 o'clock, 5:30, 7:30, Tuesdays, 5:30, 7:30, Thursdays. I wouldn't recommend that to any of you with children, little ones, because I missed out on a lot doing that many groups at that time of day. But oh my gosh, as a solo private practitioner in a little office all by myself, there is nothing as enriching as being a part of those families. I mean, it's like families of choice. You are connected at a level. I've learned more and healed more actually from my own groups in a lot of ways. So the other thing about it in terms of becoming a secure practice, you might have 3 clients cancel in a week, but your groups are going to be there unless you cancel. You might have somebody not show up, 1 or 2 people. A lot of group therapists within AGPA charge on a monthly basis, and they don't charge by session. So you say if somebody's paying $250 a month, let's say, they pay that whether they come or not. And so you got a very good, strong, secure base that you wouldn't have otherwise. Group therapy offers unique healing opportunities over and above what individual therapy can offer. And I'm going to specify that as we go through. How many people have had a group course? Yeah, good. You might have used the Yalom book. Yalom was the most prevalent and has been the most commonly used group psychotherapy book. And he talks about curative factors. And I'm going to scan through them, but I think they're really important to recognize because there are curative factors for individual therapy, obviously, too. Does anybody know what is research shown to be the most important aspect of successful therapy? Anyone want to venture a guess? Yeah.
The client-patient rapport.
The therapeutic alliance or the relationship. Yeah. That's really the case, no matter what technique you're doing, whether it's EMDR or cognitive behavioral or whatever it is, the single most important thing is the relationship. And that's something that group offers in spades. You don't just have a relationship with a therapist. You have a relationship with 7 other people. And I'm going to show you a video after we go through some of the preliminary that I made with a friend of mine, to talk about the benefits of group therapy. It's going to be available on YouTube for people to show to clients so that you'll have an opportunity. It might scare them off, but, we'll just have to see. It talks about process groups, because that's what I do. But there are lots of different kinds of groups. There are support groups, there are psychoeducational groups, there are there are like topic groups, like medical support types of groups or medical issue groups. I think it's a good idea, and I know what they do at the Samaritan Center. So I was the clinical director at the Samaritan Center and got it from like 1.5 people to 9 people, therapists. And one of the ways we did that was by instituting EMDR in groups. And so where was I going with that? It'll come back. So let's just go on. Curative factors of group psychotherapy. Yeah.
Will you go into detail on each of these security factors?
Yes. Yeah. So I'm just sort of putting them out there. They used to be 11, there's 12 now. They've added self-understanding factors, which I think is really important because I would characterize that as emotional intelligence. And that's something that many of our clients really need to learn, emotional intelligence, how to understand other people. It's a little bit about empathy. And I've actually, had clients who mostly needed to learn empathy. And so I might suggest to a client in that situation that their growth edge is to sit and listen and maybe reflect back, but not to necessarily jump in. And I might work with somebody individually and kind of help them recognize those kinds of things. Whereas someone else might be sitting off and not sharing. And I would say their growth edge is to bring themselves in and take risks, so you can, and those two people help each other, which is really important. So let me just go through of all of these curative factors, some of them are true of individual therapy as well as group, and some are unique to group. I think we all, the installation of hope is something that happens actually for clients when they make their first appointment before they ever get in, a lot of times. The universality is something that, let's see here. So the universality is something that they get, which tells them that they're not alone. And they can get that in a support group as well. But they will not get that, except they won't get an experience of that. They may hear it from you. Oh, that's common, or that happens, or you're not alone, but they won't have the experience of it. And what we know is that what you hear or talk about does not heal in the way that experience does. At an emotional, physical, neurological level. Imparting information, that's another thing that happens in individual and group. Altruism, where they can actually help someone else. There's huge benefits in altruism. There's all kinds of studies that have shown that the best way to get over depression is to be giving or doing for others. The corrective recapitulation of a primary family experience. Basically, that says it's a little bit more like transference, like you're going to get triggered by someone else, and it's going to happen in a different way than it happened. Now, I didn't put that down as unique to group because it happens in terms of mother transference and other kinds of transference in individual, not just in group, but you get a whole lot more opportunities for that in group than you do in individual. Development of socializing techniques, obviously, that's something that does not happen in individual. Imitative behavior is another thing that people learn from each other. They model for each other. I model for them, they model for each other. The interpersonal learning is the most, I think, as a process group therapist, the most powerful part of the groups that I do, and I'll talk more about that. Cohesiveness is the therapeutic alliance. So cohesiveness in the group is critically important, and we'll get a little bit more into that as well. Catharsis. We all know, it's helpful to get things out. And that happens in individual as well, and existential to some extent does that, is the self-understanding factors I mentioned in terms of the emotional intelligence. So I've really I have put these slides in, I've talked the points, but I put them in so that they would be there for people in the handouts. The cohesiveness, I think, is really important here, though. Gives members a sense of trust, acceptance, belonging, and security. So trust is huge. Anyone coming into therapy has not had a reliable, trusting experience in their lives. I mean, I think we know that that's very, very common. To have someone come into my office, I will say to them, you don't have any reason really to trust me at this point, and it's going to be a process of developing trust. You can trust that I don't have any other agenda other than wanting to see you express your highest self. But I think it's important to recognize that trust is situational. You can trust me in this office, but if you need me at the same time my daughter does, I'm not going to be there for you. So we have to kind of look at the limits of trust. This is a really important issue. I think it really helps clients to recognize that I'm not expecting them to just turn over authority to me in that way. And similarly, in the group, I normalize that trust is something that we work on building with each other. And the group process is about learning how to become known, how to get to know other people, how to metabolize judgment in yourself and others when it feels so toxic that you're being judged. But we all judge. The minute we are feeling anxious, we go into judgment mode. It's a neurological experience because we are trying to keep ourselves safe. And the way we keep ourselves safe is by looking for differences and similarities and deciding whether somebody's safe. Are they like us? Are they not like us? Those are natural kinds of experiences, but we need to normalize them so people don't do them inside and feel so bad about themselves or negative towards someone else. And so as I'm starting new people in group, I always process that with people. And I want to add a little extra element in with this, because in addition to the normal experiences with trust, think about what it would be like. Well, I'll hold off on that because after we go through these, I want to talk, I'll come back to the issue of trust after we go a little bit further. Okay, so the interpersonal learning. Members gain personal insight about their interpersonal impact through feedback provided by other members. A really good example of that is someone sitting there for weeks on end, not bringing themselves into the group. And what they learn often is that people in the group are feeling judged by them. They think they're invisible. They think nobody knows that they're not talking. They think that they don't have anything to offer. But what they learn is that someone sitting there being quiet, it's touching off all kinds of triggers in other people, that blank slate. It's a huge learning for them to recognize that they have that kind of power over other people's experience. That's one example of how that can happen. Yeah, and so giving each other feedback and getting feedback, that's the other piece. So one of the things that I normalize a lot is speaking up for yourself. how many of us have clients who have a hard time asking for what they need or setting boundaries? Those are really, really good issues to take into groups, okay? And having people find out that you can say something awkwardly and then clean it up afterwards. You don't have to say things perfectly, but you can continue to learn better ways to communicate and ask for what you need. Those are really important issues. I'll be surprised when we get through this whole presentation if you guys won't see that it's really relevant for pretty much everybody. You're going to screen people out, not screen people in. So I'm going to read this. It's kind of long, but it's important because I want to go back to the issue of trust. And also, this is like cutting edge. Don't anybody publish this because this is a paper in print. It's in publication right now, going into publication. I go 3 times a year for a training group to Austin and have been doing that for 6 years. The same people, we meet for a day and a half in our own group. And I do that to learn more, to stay current with my own stuff, so that I am a clear mirror for the people that I work with. And this is his issue. He's both an academic and a clinician. He said, while early attachment experiences have clear connections to the development of mattering. So mattering is the other therapeutic factor, the curative factor, that I think it just seems brilliant to me that no one has really talked about how important this is, and in this context. So too does the family's social position within the larger culture. Differences in social identity exist within a social stratification of power based upon economic, educational, ethnic, class, disability, religious, gender, and sexual orientation factors. This hierarchy reflects a social hegemony that serves the interests of certain classes of people at the expense of others. The systematic devaluing of people based upon their identity would naturally diminish one's sense of mattering and increase the experience of anti-mattering. You'll have to read the paper when it comes out. Thus, there are 2 important distinct pathways to mattering: internalizations and enactments, involving both family misattunements and social power, privilege, and oppression, including internalized racial oppression. So we can talk a little bit more about those things if you need clarification, but the group leader should attend to both developmental and social enactments of mattering. These enactments can become therapeutic when toxic forms of anti-mattering are altered, reducing both developmental and socially derived marginalization. So if you think about trust, okay, as a majority person, I'm a white, middle class individual. I'm a woman. I have some issues that go with that. But for someone coming in to see me, a person of color, if I expect them to trust me, that's just not likely. And for me to be cognizant and explicit with my group about those issues is really important. Has to be with the buy-in of the person of color. I can't do that without them, but that's one of the things that you would do in a screening process. So if I know I'm bringing a marginalized individual into my groups, whether it's a gay person or a person of color or a Republican, sorry, that came up the other night in one of my groups. I want to be able to clarify that what will it feel like to be an outlier with that person, but also with the other folks to say, how will you feel having someone of a different whatever in the group, and how will you incorporate that person, so that they can feel seen and heard and trust us. you know, those are really important factors to take into consideration. Okay, I'm gonna stop just briefly and ask, are there questions right now? Because I'm getting ready to show the video. And it's about a 20-minute video.
Not so much a question, but a comment in regard to trust. So it doesn't go away from me later on.
Okay,
When I ran the groups, they were primarily criminal justice referrals.
okay,
But I would break the ice in the groups at different times when they're doing the introductions and all. And I'd go with clients that have been in my group a few times. I would also, I say to each person, do you trust me in group?
Mhm.
Well, yeah, but
yeah,
don't trust me.
Yeah.
You'll learn, okay, to build trust, but I would be really uncomfortable if you responded, oh, yes, I trust you.
right. Yeah, that's great. I mean, and people who have authority issues, that can be really an issue too, to expect them to turn over power to someone that they don't know, even if they do. Yeah,
We have a question online.
okay.
Maria asks, I work with young adults primarily. How do you handle the potential development of friendships and even romantic relationships among group members?
So that's a great question, and it's going to depend somewhat on the setting. So if you're doing a college counseling center group, you cannot regulate that, you know. So the way you would handle it is say any interaction outside the group has to be brought back in. So if a relationship or sexual encounter or anything has, and everybody agrees that if there's any kind of encounter outside the group, then it needs to be brought back and discussed so that there aren't any in-group and out-group. Part of the value of group is creating a safe environment where people are not recapitulating the places where they got traumatized in the first place, like being excluded or targeted or feeling, not being able to trust that everything was being said that needed to be said. Okay. I discussed this for my process groups in the video as well. Hello, I am here with Beth Grable, who is a coach and consultant and helps people tell their stories. And I am Katie Steele, Dr. Katie Steele, P.h.D. psychologist who specializes in group and also EMDR. And I thought it would be really good for Beth to help me tell the story of group psychotherapy so that we could get the word out.
Absolutely. Again, I'm curious for someone who has never been to group therapy or maybe therapy as a whole, what do you want them to know about your philosophy on therapy and what group therapy is? What's so unique about it?
Yes. Well, I identify myself as a relationship coach because in my experience, it's clear that 80 to 90% of people's happiness or unhappiness is a function of how well their relationships work. And everybody carries patterns from their childhood, from early experiences of the ways in which they relate to one another, either at work or worked when they were young and often don't work so well as they get older and are in more adult relationships. Things like being able to tolerate conflict, you know, being able to get your needs met, ask for what you want, speak up, you know, and those are all things that I do address in individual therapy, but are much more present in the here and now in a group therapy situation. Because in an individual therapy situation, of course, the therapist is going to hang on every word that the client says. So they don't have to worry about speaking up or taking time or responding to others or how they come across in the same ways that they do in a social situation or between themselves and someone in their relationship with.
Yeah. What do you say to the person who says, well, I could do that in a group therapy session with or an individual session with you, but I would never do that with a group of strangers?
Exactly. That's
Like I would think
that is something I hear all the time. And what I say is, well, they're only strangers at the very beginning. You're a stranger to them and they're a stranger to you. The whole value of it, it's really interesting. I was listening to a podcast of a sermon that was talking about shame and how powerful it is, and how it keeps us away from each other, keeps us away from ourselves, even.
Sure.
And the thing about shame is it gains more power if it's like composting. It gains more power when it's closed in. You know, you open it up to the air and there's no gas building up.
Yeah,
You know what I mean?
true, yes, yeah, okay.
So when you can share the things just like that, like I've had people tell me, well, I can talk to you about some of these things, but I could never share that in front of a bunch of strangers. And the whole point is the things that are hard to do are exactly what people need to do to grow. You know, of course it's going to be hard.
Sure.
You know, that's the whole point. It's if you're not doing the hard stuff in therapy, then you're not learning and growing. You're not expanding your limits.
And what would you say are the hard things? Like, I imagine having conversations with someone else or speaking up for yourself. I don't know, what are some of the hard things?
The hard things for people when you've got a group, and my groups are usually between 6 and 9 people.
Okay. Is there a magic to that number? Like, why 6 to 9?
Well, 6 is the least. You need to have enough dynamics going on in the setting for people to be triggered. You want old things to get triggered.
Yes,
okay. I mean, you want so somebody reminds you of your big sister who
Yes.
who overwhelmed you, and so you sit back and you just sit there and you judge in your head and say, I can't say anything.
right,
And that's exactly the thing that happens in your outside life that shuts you down,
right.
you know?
Yeah.
But you get a chance. So my job as the therapist is to create a foundation, a safe foundation for people to recognize that it's not about saying things right. It's about putting it out there. I say this a lot in my group. Laughs about it. I say, spit it out. We'll clean it up later.
Oh, I love that. Say that
Yeah.
again.
Spit it out. We'll clean it up
Clean
later.
it up later. That's, I love that.
But the problem is that a lot of times in the outside world, you don't get a chance to clean it up later. You don't get a chance to dig deeper about what's going on. So for instance, the person who's getting triggered, they're having a big reaction that's negative about the other person. Okay. But it's not about the other person. It's about their filter. It's about their history.
Yeah.
And that probably is one of the biggest things for people to learn in group is not to take things personally.
Right.
You know,
Yes.
that, okay, somebody's getting triggered by me. I don't have to get all bent out of shape about that. And I'm there to intervene.
Yeah.
Okay. So when that starts to happen, some conflict can come up. That's good.
Yes.
To be able to learn how to work through conflict instead of letting it shut you down.
And I know it sounds like group therapy might be the safe place to be messy, right? Because we can all think about these conversations in our heads, but when we go to actually have them, we freeze or we
don't have
them.
We go through the whole conversation
Yes.
in our heads and tell ourselves what the other person's going to say back that then you don't have to come back for.
Yes.
And so you don't even say it.
Yes. Is there a certain time period that you ask for people to commit to group therapy?
So it's interesting. When I first started, I asked for a commitment of 12 sessions.
Okay.
And I still do that when people are a little reticent, okay? Because Otherwise, it takes that long for people to start to recognize how they can fit in. Okay. It's an uncomfortable process. It's not like people are gonna come in and just feel, oh, you know, this is great. I mean, you think about it in terms of like physical therapy or working out at a gym, right? It's not going to help you if you don't push yourself to a certain discomfort level.
Yeah.
You know? And so that's what I normalize. It's like, don't run away from the discomfort, embrace it.
Yeah.
I try to present it in a thing. You know, I don't want people to think that it's not a support group, it's a therapy group.
Yes.
You know,
Yeah, describe the difference from your perspective.
So a support group often is not leader led, okay?
Mhm.
It's a people usually with a similar issue who come together to support one another, and there's real value in that.
Yeah.
You know, I think that. Even if it's like, let's say it's a 12-step group, you know, to be around other people who are. You know, putting their stuff out there and you don't feel so alone. And that happens in my groups as well.
Sure.
Big time.
Sure.
You know?
Yeah.
I asked my group members, current group members to see if they had a comment or two that they would share. And one of them, so he was kind of being funny, but he said, I have people who will call me on my show.
About that.
He said, you won't say that. I said, I probably will.
And you just said.
Yeah, I said, you mean be accountable. It's not be accountable to me, it's be accountable to people he cares about,
Right,
you know,
right.
about making good choices in his life.
Yeah, yeah. So 12 sessions, is this monthly, is this?
It's weekly, it's weekly,
Okay.
yeah, it's a real commitment, and that's a big piece of the. Healing actually is that willingness to make that commitment to yourself and to these other people in the group. You know, that you're gonna be there, you're gonna be consistent, you're gonna, so the one thing I ask, you know, kind of, it's the main contract. Put your thoughts and feelings into words, not actions.
Wow.
Okay,
Yeah.
put your thoughts and feelings into words, not actions. And so an action is also shutting yourself down,
Right.
you know,
Mhm.
it's holding back.
Mhm.
So certain people will have a tendency to hold back. And they think that what they either think that what they have to share isn't as important or isn't as profound, or what they're going through isn't as bad as what somebody else is going through.
Right.
And then, but then they feel on the outside. So a big part of the healing process is to bring yourself in and recognize you're not alone.
Are there ever instances where there are people who are in individual therapy and in groups?
Frequently.
And what would be, you know, are there like certain things going on in their lives or certain seats that?
What are the ones who do both?
Yes.
So, yeah,
I guess you asked me when you recommend the
Both.
words and both. Yes.
well, in the beginning, as someone's adapting to group,
Okay.
it can be helpful,
Okay.
you know, because they go inside their head and they haven't really made that transition into speaking it in the group. And I can help them kind of recognize choice points for themselves where they can bring something back to group.
Yeah.
You know, and that's a good way to help. And there are people who have pretty severe, and not severe in the sense that you would recognize it, you know, interacting with them, but who do a lot of self-talk that's negative, that can, and it's where it's really hard for them to bring that up in the group.
Yes.
And so in those situations, a lot of times I'll suggest we do some one-on-one. I do NPR with people, you know, if people have a huge reaction. It's an interesting story. I had a group once where I had 2 retired policemen in, which is really unusual.
Oh, wow. Yeah.
Retired, I mean, it's unusual to have police in therapy at all,
Right.
much less in the group. And this one, and I also had in there a very strongly social activist professor.
Okay.
And she was talking about, you know, some civil rights kinds of movements and things. And he was just getting more and more and more kind of talking to her about what you know, how unrealistic she was and how this was not the real world. And he was shutting down and shutting down and shutting down. And my sense was he was going to end up just folding. So I met with him individually.
Okay.
And what I did was, and we can talk another time about what the NPR is, but we targeted his emotional reaction to her in the moment.
Okay.
And as we did this eye movement, which allows people to get in touch with some things historically.
Yes. EMDR stands for.
Eye movement desensitization and reprocessing.
Okay. It's a very helpful technique.
It's very, yes. I think it's pretty well known now that I
Yes.
don't need to go the whole thing,
Yes,
but
I agree.
but what he did was flashback on an undercover uh a time he was working undercover in a crack house.
Okay.
And there were babies, black babies, there was in particular, crawling around on the floor and there were roaches everywhere. And he flashed on that and burst into tears. And what he realized was, because he couldn't do anything, you know, he couldn't intervene. There was just nothing he could do. And but what he realized was that he had distanced himself from his empathy to protect himself.
Interesting.
Yeah.
Yeah.
And so he came back into the group and he apologized to her and said and talked a little bit about it. I mean, it was just magical.
Wow. I don't want to go into for the rest of the people in the room to see someone who had an outburst earlier come back and
Oh,
apologize.
yeah.
I mean, that's therapeutic. in
It
itself.
is, and it happens without an intervention like that as well. I mean, I had one client that I've pushed her some, and she gets big reactions, and you can't really work with it in the moment very much, and I'll let it go, and she'll come back the next week and she'll apologize and say she realized, you know. But and the thing that's really interesting is that the other group members get to witness the way that can work. You know, I don't have to win the argument. I don't have to keep pushing it,
Yeah.
you know, and she gets some space to kind of process through in her own head and come back and we can talk about it. And I don't take it personally that she gets mad at me.
Yeah.
You know,
Which requires your own work.
of course.
Yes.
Oh, yeah.
Yes.
Yeah. I have to stay good with my own work.
Yes.
Yes, I do.
What's that like for you to be a real human and the therapist and facilitator of that group?
Well, that's interesting that you bring that up because that same client, this was just revisited recently, but she made a comment about this was years ago. She made a comment about going to sleep without brushing her teeth or something, and I flinched, and she took it really personally, and I reflected on that, and I realized, and I came back the next week, and I said, you know, that was triggering something for me.
Interesting.
Yeah, I said, because my sister used to do that, and I was forthcoming. I said, my sister used to do that, did not take care of her teeth, and she ended up, they were all just falling out. She went, and there's a bigger story. She went to Mexico, had dental implants. Wow. And when she woke up, she had blisters on her chest because they had taken 36 x-rays without protection. I typically, that kind of thing doesn't get triggered to that extent, you know. But it's my job to really reflect on it. And if it does, to come back and own it.
Yeah. Say someone watching decides that they'd like to take the next step towards group therapy. What's a great next step for them?
So the best thing would be to do some research on it. I think do some reading on Google, and see what things are said about it. Generally, one thing I would say, it is usually half the cost of individual therapy. And people always wonder whether insurance covers it. A lot of insurances do.
Okay.
Medicare does pay poorly for us,
Sure.
you know.
Yes.
But I slide my scale for people who don't have, or whose insurance I don't take.
Okay.
You know, so it's usually about between 40 and 65 a session. Yeah, which is very reasonable. Very reasonable. 65 is the set session, and that's less than most. And I'm in a situation, because I'm semi-retired, that I can kind of slide my scale more, you know, than some people. But that would be the thing to do, or to give me a call, or go on my website, which is wellnessassociates.org.
Okay.
Yeah.
Associates.org.
Yeah.
Yeah, you bring up a good point. Last question for you, because I want to be mindful of time. What are the group goals? Like, I would imagine, confidentiality, this is like you said,
Very
it's the
much.
therapy session, not a.
Right, exactly, and that's one of the differences. Support groups, people get together afterwards and socialize with one another. My groups, I try to keep them as safe as possible by having people not interact outside of the group. You know, it's anonymous as much as possible. It's a small town, so people, but we don't use last names. You know, we don't talk about the specific place people work, or, where it's identifiable. It's certainly not in the beginning. People get looser about that sometimes later.
Yeah.
As they get really, really comfortable with one another.
Yeah.
Okay. So, that's the main thing, and that people come regularly.
Okay.
Because if someone doesn't come, they miss too much, and then they feel on the outside, and they don't know how to bring themselves in, and that's exactly what we want to avoid.
So confidentiality, commitments, and as much as not.
Yes.
Okay.
Yeah.
Okay. Thanks so much for.
Thank you. Okay.
Okay,
Hello.
whoops. This is just a little funny. I don't know what happened. Oh, there, that's the other one. This is the difference between a support group. And for those of you who might not be able to see it for some reason, it says, welcome new members, socks without partners. The last thing I remember is being thrown into the dryer. Okay, questions. Questions about the video, anything that was, yes. Oh. Is that still? Okay, sorry, questions? Yes.
So do you do an individual like intake session to get them ready for the group? And then how do you notice in the group if that person would really benefit from individual sessions as well?
Okay, good questions. Yes, the preparatory, the prep for group is really important. It's where you're doing a screening to determine whether someone is appropriate for group, whether it will help them. It's helping them recognize. And interestingly, like I talked about how my own group practice started, I had my office set up in a circle. And when people called me, I immediately said, I'm a group therapist. And when they walked into the office, I said, I'm a group therapist, sit wherever you want and I'll sit across from you. And I am constantly talking about, ooh, you would really get benefit from group therapy about that. All of these issues that we've been kind of hitting on, those are going to come up in individual therapy, and you have a chance at that point to talk about how group can be healing with that, kind of get them ready in that way. When someone refers to me for group from outside, another therapist doing individual therapy, I always ask to have 3 sessions with them ahead of time before they would go into my group, so that we can establish a relationship beforehand, because I will be the only relationship they have going in there. My groups, the 2 groups that I have going now, are still groups that started back in 1991 and 1992. They are not the same people. They have, morphed and morphed and morphed and morphed. I add 2 members at a time so that somebody always has a cohort. So I let my groups get down lower. My groups are closed, but open to change. Okay, so people can't drop in, people don't come and go. I ask for a commitment. It's about developing relationships. That's what it's about. It's about learning how to be in a relationship. And you need to be consistent. You need to take chances. And people need to be able to trust that if something blows up with you, that you'll be back the next week and we'll work it through. And they get that experience. So, yes.
So you do it in cohorts, it sounds like? How?
I don't meet with them as cohorts, but I introduce them into an ongoing group.
Okay.
In pairs or 3, okay, so that they don't, and we go through a process, an introduction process, so that they get to the ongoing members get to share their own experience in the group with the new members, which is an immediate installation of hope. They see where they were and where they are now and what they're working on. So, and I use the metaphor, I said, you know, starting in a brand new group with 8 people who are all brand new is like getting on to one of those old locomotives in a train station that's completely dead stopped. And you have to stoke the engine and you have to build up the steam and then you have to start getting out of the, and it goes, you know, slowly. You're getting on a running train. So, you know, we're going to slow the train down. Everyone in there is going to reach their hands back, but you're going to have to run and catch up. And the value of that is you're going to move at a clip. Once you're on, you know, you have the benefit of the train already being in motion. So it's really helpful. I did do at one time I did a 12-week group. I was trying out a new thing that I've learned at AGPA, which is really interesting. And there's all different kinds of groups that we don't realize, you know, when we're trained with Yalom. I mean, there's all different, and I've got some information in here for you about that. But I was thinking that would then lead into a longer term group. That's not a bad way to get started. People are reticent to commit to a longer term commitment, you know. But when they come into when they first come into the group and they learn that people have been in there 5 and 6 years, they go, you know, I could. And then when they're introducing themselves to the new members, they say, I remember I thought I could, what are people doing in this thing for 5 years? And here I am, it's been 7 years. I can't believe it, you know? So, yeah.
So what's it like then with what you're describing? If somebody says, you know what, I feel like I'm done, right? That's, I'm assuming that's brought to the group.
Oh, absolutely.
Somebody is basically exiting. Like, is there openness to people leaving when it's time for them?
Absolutely. And I will say that frequently when they say they're done is when they haven't started yet, you know, when they have held themselves back. One great example is the person I had described who has big reactions. She had sat on the outside of the circle for weeks, not bringing herself in, actually would kind of push her chair back. You know, that's a telltale sign. And then she said, you know, I just don't think this is the right, you know, I'm good. That group is good for me. And she said it in the group. And I said, let's talk about that, you know. And what I pointed out was, you know, what did you come to group for? Because she had trouble with relationships in her life. And I said, is it possible that you are keeping yourself out of relationship and by not talking with us, by not letting us in, and that this is exactly where you need to be right now? And she's been in the group for years. I mean, she's made huge progress. When you can use the here and now, okay, to connect to their outside issues, and it's really important to be doing that, you know, and they do connect. I mean, it's almost always very, very evident of what those issues are. Yeah.
So have you ever had a situation where there was conflict within the group that just could not get resolved in the moment, or?
Well, in the moment, yes, but people come back and then work it through. So this is another interesting story. I had a group member who was, she would come late regularly, or she would miss. And it was always, her life was so much more complicated than everybody else's, you know. And at one point she missed, and I didn't get word. And that's really important that I get words, because otherwise people are worrying, you know, about a conflict that somebody wasn't coming back to work through or whatever. And so when she came in the next week without ever saying anything, and I confronted her, she got all angry about, you know, how important her life was and how, you know, she had more going on than anybody else and blah, blah, blah. And I didn't let it drop, and I kept pushing it. And she got up and walked out. And at the time, I was in a little office where you could see the street from where I was. She was out there walking back and forth in front of the building, and people were scared. scared of her. I mean, she had that kind of energy. And she came back in afterwards. Turns out she'd left her keys on the table beside her. And so that was why she was pacing out there. It wasn't that she was waiting to get us. But she didn't, I tried to ask her to come in for an individual session so that we could process through, do some EMDR, you know, all of those things. And she pushed me away, but she was also seeing Dr. Nasser, who I collaborated with. And he kept seeing her and he kept encouraging her to go back to group. And so she contacted me and she says, I don't know if you would even take me back in group. And I said, well, I have to check with the group. And so I did. I checked with the group and they said, yeah, we'll take her back. We have to clear this up, but we'll take her back. So she came back into the group. And when she heard from them that they were afraid of her, it changed her at core. She completely shifted and became less defended, less special, you know, it was all about shame. You know, it's always about shame, you know. So my sense is we can work through anything as long as people are willing to do the work. So other questions? Yeah.
How does, I don't know if you say agenda or goal setting for each group, like how does that work?
So I don't have an agenda for each group, okay, or even for the groups in general. I haven't said this, so I'm glad you asked this question. So I describe to people that if you think of group as like taking up this much space, you know, it's this long, then this much is about the topic and the content of what you bring in and talk about. And all the rest of it is about how you do or don't talk, and how you present it and how you speak up for yourself, or, you know, so what I do is I start every new group out, like when new people come, then it's a new group. Okay. And I started out with a sort of a formula of how people talk about how group has helped them and what to expect, and then talk about confidentiality and the importance of safety and what makes the group safe. And then each person introduces themselves and we go around from the most senior to the newest people to introduce themselves. But beyond that, the rest of the groups until the goodbyes, which are also kind of have a format, they are wide open. People can come in and bring whatever they need to bring in. I start each group out with reactions to previous groups. So I make space for continuity and for people to process. Like lots of times people will leave and have a delayed reaction to something, or they'll be beating themselves up, or they'll wonder what that face meant when they thought they were talking and somebody made a face and they took it personally. And so these are opportunities for people to clarify and learn about other people and themselves, you know. At the end, I always end with, is everybody going to be here next week? And so, but between that, it's wide open. So, yes.
Two questions. Well, number one, over your years as far as running the group.
I'm sorry.
Over the years of running closed groups.
Right. 40 years.
Probably 40.
Yeah.
What common demographics do you have within your group setting, or is there any commonality?
The only commonality I would say is that they are fairly psychologically minded. You know, I've usually worked with them individually. There are very few that I put into my groups who haven't done individual work ahead of time. So they know, they have some sense of that. That's not necessary. You can put people into a group without all of that. And then the group focuses around that, you know, helping people like you would do more sort of structured things to help people get to know each other and recognize how you want to interact. That would work. Hold on. Yeah. And then
The other question would be, many groups that are out there, they're not closed-end groups. They're open-ended. In your studies of those open-ended groups, do you find it more difficult To build the characteristics within those groups.
Sure, I mean, because you got people coming and going and the trust doesn't build. You know, you've got to have that core trust, where people can work through things, because it's too easy to walk away when that's what we do in our lives too often. When we don't say something that we need to say, we're gonna walk away, and then we miss that opportunity. That just almost happened when I mentioned something about Republican. Okay, so the day after the election, there were a bunch of people in the group who were having traumatic reactions for one reason or another. And they started talking about it, and it started becoming unidimensional. And I actually, when the person said I need to talk about the election, I said, be aware, because I had just added 2 new members, and I knew one of them was gonna not be in the same camp as everybody else in the group. And so I said, just be aware that we don't know that everybody is going to feel the same way about this without outing that person. But it kind of blew up, where she felt nobody was ganging up on her. She didn't say anything that anybody, and they wouldn't. I mean, it's a very loving, supportive group. But she felt that because so many people were, their experience was from the other side. And she came back this week, yesterday, and said, I almost didn't come back. You know, I thought maybe this isn't the place for me, and people won't like me, or I'm on the outside, or, you know, all the things. And she said, and then I realized that's probably why I need to be there, because it's not true, but that's what it feels like. So.
Can you talk a little bit, you had mentioned the different types of groups, and it sounds like you do a processing group.
Right.
Can you just give a few words on like the different kinds of groups and what the real focus is of each type?
Sure. So, I mean, you've got DBT groups, you know, dialectical behavior therapy, that are really kind of emotional regulation types of groups, if you will. Actually, let me go. There are training groups that I participate in a training group. American Group Psychotherapy Association offers a training event, a conference every year. The first 2 days of that conference are intensive training groups for people to, 50 groups going on at once with about 12 people in each group. And you're learning both about yourself, but also about a form of therapy, that kind of thing goes on. That's what I do in Austin when I go 3 times a year. Self-help, obviously, all kinds of groups like that. So, and actually, let me keep going here just because I'm gonna run out of time. There we go. Just another cute, that was actually me at one point. Yes,
We have a question on.
sure.
Maria asks, how do you document group sessions compared to how you document individual sessions? For example, does each group member get the same session note, or do you customize for individual members?
Both. Okay, so I write a group note, which is included in everybody's, and I use only initials when I talk about any individual dynamics going on. But then each person has, and it's wonderful because I use therapy appointment, and it has that option so that I can that was the way I chose which EMR I was going to use, but because I needed to be able to do groups, and then it generates the fees and everything with that as well. Is that it?
Yep.
Okay. So I have mentioned this a little bit, but the benefit of group, it's more efficient, it's more effective. So in terms of building an individual practice, when I have had people in my groups, they talked about it. They get to the point where they're not hesitant to talk about their therapy, because it's real normalized. They don't have shame the way a lot of individuals may. And you get all kinds of referrals from people who have gone through your groups. People see changes in them and say, what's going on? And it's really beneficial with that. And they can afford it, and if I have 4 people paying full, I have the wherewithal to slide for 2 or 3 people. You know, that works really, really well. And I've always had a heart for that from the very beginning. I've never, ever worried about, I've never had to worry about having enough, either in terms of clients or finances or whatever. I've just really been fortunate. So what are the next steps? How do you identify good candidates for group? I hope you have recognized some of that. I will say that it's more a question of who's not appropriate for group, okay? Someone who cannot accept any kind of feedback, you know, is not able to look at themselves, is unwilling to look at themselves, doesn't have a capacity for psychological mindedness. Narcissists aren't really good for any kind of therapy generally. They don't really want help. They want you to fix somebody else. People who are who have a tendency to be psychotic, you know, or highly suicidal, I would screen out of a process group. That doesn't mean there aren't groups for them. It just means you wouldn't put them into a process group, okay? So again, it's not even whether or not someone's appropriate for a group, but it might be what kind of group would they be appropriate for. Where can I train to lead groups? I've got that coming up. And where can I find a group for myself? I've got that coming up too. It's in your screen. It should be in your handouts. So this is a set of questions that could help screen whether someone's appropriate for group. Do you want to better understand how you affect other people and how other people affect you? Do you struggle with assertive communication? Do you often worry about what others think about you? Do you struggle to identify your feelings? There's lots more, but those are some just kind of basic relational kinds of questions. The American Group Psychotherapy Association, this is the conference that I talked about. It's coming up in March. You should be able to click on this link and get the program. The AGPA Connect 2025, where I've got my mouse right now. If you click on that, it will bring it. If you did you send out the, is it digital? You guys, everybody has digital, or
Everyone received a PDF
that
that you sent last night to us. So if you did a new version and this week is only part of the new version, they will not get it.
it's not part of the new version. I just wondered if they get it digitally or they just get it, they get it written. They get something that they can click on. That's what I'm asking.
I'm not, we have to see. We
Okay,
can resend it in whatever format.
Okay, if anybody that online,
The PDF that you sent has a hyperlink to that.
that's what I wanted to know. Okay,
Get on.
okay, good.
Yeah.
So, and I want to announce that there are scholarships available. And if people are interested in going, I would very much be willing to help with that. John, Eric Mist who is coordinating groups at the Goshen Oaklawn, he's very involved in all of that. I supported him to go. He got a full scholarship that included some travel money as well as the conference fees. Anyone who applies, and it's not easy, but you don't even have to do it by a particular time, but anyone who applies gets something to help. So I would strongly encourage anyone for a number of reasons, because there's so much to learn. But it's also, that's been my professional home for the last 30 years. And it's been, I've only missed a couple of sessions in all of that time. It's really worth doing. This is in there, you can take a look at this, but these are some of the kinds of, this particular, it's all done in workshops pretty much. It's not like this where you're sitting and it's one of the reasons why I engage as much as I do. I'm used to doing my presentations in a circle where we're doing experiential stuff. So you learn experientially there. This is one of the workshops that's going to go on, and it integrates psychodynamic internal family systems, interpersonal neurobiology, and polyvagal theory in there. And it's gonna be, I mean, that's gonna be very rich. I'm gonna go to that one.
Virtual session,
That one is both virtual and in person.
where's it in person?
It's in person in San Francisco.
Hello?
Okay, but the ones that I have on here are virtual. These are things that you can access from here. Okay. Adopting a multicultural orientation to work with international students of color and heterogeneous interpersonal process groups. There are lots of good presentations on multicultural and DEI topics that are really helpful, for those of us who are continuing to educate ourselves, which hopefully is all of us. This is the Great Lakes Group Psychotherapy Society in Chicago, and they also have weekend events twice a year. That's me, by the way. That was a social hour that we had in Chicago, which was lovely. It's nice to have. I have community all over the country because of these experiences. So locally, we have this is Sean Flynn has a mixed gender process group that she is accepting members for, and that's locally. And this is a training group that Sean and Angie Law from the Samaritan Center are offering. Unfortunately, they're only accepting members, male or persons of color at this point. Those are the people that they have openings for right now. But this is what I wanted to go over too. These are the Oaklawn adult groups that are going on. Take a look at this because there's lots of different types of group going on here. There are ones for people with serious mental illnesses. There are trauma groups. There's a mindfulness group. There's a women's self-esteem group. So those are kind of similar issues getting together, but the women's self-esteem group is going to be probably a process group. It's, you know, that's the kind of thing. So is the men's mental health support group. So there's lots of different options locally, and hopefully there will be more. Oh, I don't know that I want to show that. It's just funny. I'm trying to find something to intersperse some humor, but so I'm amazed to know that worked out that well. I could have said so much more. I have so many more things to say, and I realize, you know, but if you're interested in doing something more with group, the other thing that I do that's a possibility is I have had people learning to do group by sitting as process observers outside my group circle, taking notes and then writing the notes up. And then I go over that with them as a learning. And then the group members get the notes to be able to benefit from that. That's what they get out of that. And I do that as a service. I want to spread this. So that's it.
Great. Thank you so much.